Horsepower. Learn how a local oncologist takes inspiration from horses and in turn helps teach students compassion and empathy. For a third straight year, Burrell is honored for its diversity, one of only 27 medical schools to achieve this recognition. Find out what this means. We sit down with the mayor of Las Cruces and learn about the positive economic impact of a medical school in this region. Suturing, airway management, and intubation. We speak with two medical students and learn about some of the skills they're working on during their path to becoming doctors. All that and much more, so let's get started. Hey everyone, welcome to the DO Pulse, a podcast about osteopathic medicine, community, and education. I'm your host, Sydney Alvarez. This podcast is brought to you by Burrell College of Osteopathic Medicine and sponsored by GCU. Learn how GCU is the credit union that can help you meet your financial goals. Visit gcu.com for more. Now, the Burrell College of Osteopathic Medicine is proud to announce that it has been honored with the 2024 HEED Award, which stands for Health Professions Higher Education Excellence in Diversity. The recognition is from Insight into Diversity magazine. Out of the 42 accredited osteopathic medical schools and 158 accredited allopathic medical schools, for a total of 200 medical schools in the United States, Burrell College is only one of 27 medical schools to receive this honor. Now, this marks the third consecutive year that Burrell has been recognized for fostering an inclusive, equitable, and diverse environment within the healthcare profession. Congratulations to all. Now, in other news, here's a story of an oncologist and a Burrell faculty member who uses her lifelong passion for horses to help teach future physicians about compassionate care and effective communication. Watch this story.
Meet Dr. Mary Lacaze. She's riding 15-year-old Goober, a quarter horse. Dr. Lacaze has always had a love for horses. In fact, she uses horses as inspiration for her work. She's an oncologist and now teaches future physicians at Burrell College of Osteopathic Medicine.
I just love the strength and the grace of the horse. The animal is beautiful to me, and to be able to be one with it is amazing. I got into them because of being an advocate for equine therapy for oncology children, my patients. And so I would go out there and I thought, this is wonderful therapy. And I thought, I could de-stress with it too, and I wanted to ride. So I, started riding horses.
For Dr. Lacaze, horses are powerful symbols of trust and a means to learn nonverbal communication. Skills she says are essential to the doctor-patient relationship.
We learn from them, and the sensitivity, it teaches you to focus, listen, and really pay attention, because a lot of us don't listen.
Here at the ranch, Dr. Lacaze says that the horses are helping her learn empathy and compassion. But this is not the only place where the lessons can be learned. Dr. Lacaze brings her teachings right here into the classroom, where she reminds future doctors about patient care and cultural humility.
Inside the classroom, Dr. Lacaze lectures on this subject, connecting her experiences from equestrianship to medicine, teaching her students how compassionate care and careful communication are critical to mission medicine.
The 21st century physician that we're training, I think there's a lot of objectives here, and the training of medical students is changing. It really is inner reflection and critical thinking in terms of what they bring to the table, and what they come with when they engage with a patient.
And her students get it. Understanding healthcare disparities and multicultural diversity is real.
I think Dr. Lacaze does an amazing job. The course Mission Medicine is just amazing because it's tying so many different aspects of the community and our community at Burrell together. As a person of color, I think it's really awesome that we have a course that incorporates all these different walks of life. I think oftentimes you don't see that at a school, and you don't see that being offered in a healthcare setting.
As our job as a physician, I think it's definitely essential to, make sure that they are being provided with the compassion and empathy, that they need to allow them to feel better, but, to also heal better as well.
And back at the ranch, Dr. Lacaze continues with Goober, drawing inspiration to help shape a new generation of physicians.
I'm not saying, of course, that everybody has to work with horses or have a horse or be among horses, but I think that animals do teach us compassion, and I hope to use what I have learned with the animals, particularly the horses, to help students really gain insight to compassion and empathy for their patient.
That was a great story. Now, as you know, Burrell has been shaping the future of healthcare professionals right from our very own backyard. But what does that mean for our city and our community? And as you can see, I have a very special guest with me now, the Mayor of Las Cruces joining us, Mayor Eric Enriquez. Thank you so much for being on the show. We appreciate it.
No, thank you. It's my pleasure to be here.
Thank you for taking the time to be here. Now, I want to talk about Burrell, Las Cruces, and being community neighbors and advocates, so to speak. And I have a few questions for you. My first question is, what does having Burrell College in Las Cruces mean to you personally and our community?
Oh, it's great. It's great for the community. It's been a game changer. Having an institution like this here for students to become physicians, better health care in our community or throughout, just having individuals come and visit our community and knowing that our community has the Burrell College here is tremendous.
When I think of a medical school in a community, I personally think of the economic impact. What kind of an economic impact does a med school have to its community?
For us here in Las Cruces, it's huge. We are a location that I would say is a beautiful community. We have the Oregon Mountains, we have the beautiful sunset, but we have sunshine, the sunshine that's here like 300 days out of the year. So we have a lot of people that come into this community because this is where they want to retire, this is where they want to live. And one of the first questions they always ask is what's the healthcare like? And not only mentioning that we have hospitals, but we have an institution like this here for higher learning for physicians is great. And I know our realtors in this community benefit from that, our home builders benefit, our developers, and then so all the small businesses in this community, it's helpful when we have more people coming in here, and healthcare is a huge component for them.
I think of quality of life. People think entertainment, the educational institutions that are there, but right there as well is, as you mentioned, medical care, correct?
That's correct. The health care, and that's what I'm looking for as a mayor. Is we want well-being for our community, and with the sunshine, we have a lot of activities that seniors and youth can enjoy in this community, and unfortunately, with some of those activities come injuries or come illness. And
accidents can happen anywhere.
Yes, and so that's why it's great to have the health care in our backyard.
How do you see the medical school, Burrell, shaping the future of Las Cruces?
Well, again, talking about health care and taking it to another level, and that's always important. It's always that example of the expert lives 60 miles away. Well, if you want to get good treatment, go to El Paso. In El Paso, go to Houston.
Yes.
It's always somewhere else. This will change that mindset. This can change the mindset that we have the experts here. And it's like, come to Las Cruces if you want to be treated properly.
Absolutely. And it is not just about getting the experts here. It's about cultivating the experts in our own backyard, right? So our students, they get trained here, and we want to retain them here. What can we do as a community, as a city, as our mayor, to make sure that we're trying to retain that talent here?
Well, provide better opportunities. Like I said, developers, home builders, we're doing all those things, but to create that job creation, events, other, like when we're talking about well-being, it's not just healthcare, and it's not just physical, but it's also public safety, and it's also the entertainment, it's also cultural, all of those things that we can put together so that people can stay here because they know they'll get a good quality of life.
You know, let's talk a little bit about our students. We have some time. Our students are so active. They're organizing events, they're part of events. You know, we see them out there with all these different other community organizations. How, in your opinion, do you see that as contributing to helping our underserved, maybe folks that may not have, you know, good quality care here in Las Cruces?
Well, I can say on a personal experience, I served as a fire chief. And I was a fire chief and assistant city manager for the city of Las Cruces during COVID. So in 2020, we highly utilized a lot of the students for Burrell, whether it was testing, whether it was vaccinations, it was events and helping out with the community as a whole. So these students came out and helped out and were a part of the community during a time of the unknown. And so now that we can plan events and we can look at those type of things where people are underserved, is utilizing the institution and the students to help out. And I think it just helps us to grow as a community, to be united, and to showcase the students as well. That's what we have in our own backyard in our community is great.
You know, we're running low on time, and I want to make sure I get a couple of more questions in with you. How do you see the future of Burrell and the city of Las Cruces developing and growing together for the benefit of everyone? How do you see this, you know, evolving?
Well, as I mentioned, my past experience, Burrell has a lot of equipment, technology, innovation that we, even as a fire department, were able to utilize. And also, we can partner and have students do ride-alongs with the fire department so that they can go out and see what's actually going on in the field. And it's a win-win combination. So that's just one aspect. We can take that to another level and showcase that to our whole community, allowing our students and our school districts to know what's going on in our high schools and everyone else in this community, other organizations, so they know what is coming out of here with our students and our future doctors.
Sir, I want you to look at that camera, and I want you to just kind of share to folks that are watching, if they want more information on what the city is up to, what you're planning on doing, how can they get more information?
Yeah, if you want more information, visit Las Cruces is a great avenue to get in touch with what's going on in Las Cruces, and we'd like to also partner up and get Burrell more involved with our Visit Las Cruces, so visitors, residents, everyone can know what's happening in Las Cruces and how we're working together to be one community.
Mayor, thank you so much for your time. I know you're very busy. We really appreciate it.
No, thank you. It's a pleasure.
Thank you. We'll be right back. Suturing, airway management, and intubation. We speak with two medical students and learn about some of the skills they're working on during their path to becoming doctors. That's next after the break.
Here's to the unseen late nights, learning curves, and your perseverance. The behind the scenes is where the magic happens. It's where you shape your process and where you don't let anything hold you back. GECU is there to support you through it all with the products and services that you trust, so you can focus on making your own path. Become a member online now at GECU.com.
I got it! I got it!
Hey everybody, welcome back. As you can see, I'm joined now by two very amazing guests. I'm joined by second-year medical students, Samantha Lester and Andrew Pease. Thank you both for being on the show.
Our pleasure.
Thanks for having us.
Oh, absolutely. Now we're here to talk about a skills day that you had with the surgery interest group. And we're going to be talking about three things: suturing, airway management and intubation, and sterile gowning and gloving, correct?
Correct.
Cool. All right, so the first thing that we're going to talk about is suturing. So Samantha, I understand that you're going to help us with this demonstration. So we have some materials here. Hold them up. Be careful. I see scissors. I'm already worried.
So we have our fake skin sample here, and then some suture and instruments. So when you're suturing, you're either closing a laceration.
Can I hold it?
Of course. Or a surgical incision. And there's different types of suture that you'll use in different situations. There are braided, there are monofilament, some are dissolvable, some are not. Some are bigger diameter than others, and they each have a different type of needle on the end. So there's a different suture for every purpose. And then you'll use your instruments. So you have a needle driver, scissors, and a forceps.
Okay.
The forceps is to use to hold the tissue while you suture. The needle driver holds the needle, and then the scissors will be to cut the suture when you're tying.
So right now, through the magic of editing, our viewers are able to see some suturing that is actually taking place, and they'll be seeing this as we're having a discussion. So let's talk about how one learns to suture. Tell me about that.
Yes, so a great way to practice is on models like this. They're available on Amazon, but the more you practice, the better you get. So learning to tie knots, practicing on even just a shoelace tying knots, and using instruments, getting used to the feel of them in your hands and how to place your fingers is important.
I'm gonna say, is there a certain technique when you're suturing? You know, the needles going in, is there a certain way to have the needle enter the skin or pierce the skin?
Yes, and it depends on what type of suturing you're doing and the type of stitch, as they would say. So you're going to enter with the pointed end is either going to be a cutting needle or a tapered needle, and that'll either cut through the tissue or push through tissue, depending on the type of tissue you're working with. And then you will grab different distances away from the incision based on the type of tissue as well.
No, can we talk about the skin for a moment? The training or the what do we call this? The
suture pad.
A suture pad.
Yeah.
Okay. So you know, the way it feels, it's you know.
It's like gelatin.
Yes, it is.
It is.
So it's designed to I guess have the density of a person or the skin.
The best ones on the market are designed to feel like skin. Not all of them are going to be very representative of actual human tissue. Sometimes you can even practice on things like banana peels. That's actually a good indicator of skin too, texture. Okay,
so if I was a student and you're trying to perfect your technique, how are you graded? What are they looking for?
So you're looking for uniformity of your stitches, so equal distance apart, equal distance from the incision itself. You're looking for the correct depth, and then depending on the type of stitch you're doing, you want either the knot to lie flat or above the skin if you're doing interrupted stitches.
Oh my gosh. And then of course all this is dependent again on the type of suture itself, right? So are there, like, how many types of sutures are there?
Hundreds.
And so you have to perfect every single one?
So different specialties.
Andrew's nodding, he's like, yeah.
I mean, different specialties in surgery will use different types more often than others. And so you get used to the kinds that you use the most often.
All right. Samantha, anything else you'd like to stress about suturing techniques?
Just for students, practice makes perfect. So I recommend getting a practice suture kit and practicing as often as possible.
So when you first did your first suture, well, you know what? Let's get some background on you, because you come from a hospital background.
I do. I was an operating room nurse. I did circulating as well as scrubbing in the operating room for 5 years.
So picking up a suture and sewing somebody up kind of not necessarily came natural to you, but you were prepared.
Right. I was more on the end of knowing what type of sutures the surgeon wanted, the instruments. I was very well versed in those things, but actually performing the suturing was new to me.
Sounds good. All right, let's change gears, and we're going to bring Andrew in here. We kind of moved our setup a little bit. We're going to talk about airway management and intubation. So we have our mannequin here.
Yeah.
Okay, so when would this be necessary?
So airway management is just a general term that's used to anytime that we need to control someone's ability to open their airway. So there are three main kinds of airway management. There's manual manipulation, where we will manually open someone's airway by adjusting their head. There's little adjuncts that we can put in there to make that easier, but that's mainly what we're doing there. Now there's also what's called a blind insertion device. Those are known as laryngeal mask airways or King tubes. And those are put in blindly. So you take a patient, you hold their airway open, and then you insert this tube into their throat without looking where you're going. You inflate a couple balloons to create a seal, and then the air will be able to be blown in using the BVM like we have there, the bag valve mask.
And you said there's a third one?
The third one is what we consider the most definitive airways. It's called endotracheal intubation, which is what I'm going to show you here in a couple minutes. And what is done is we use what's called a laryngoscope to open a patient's airway through their mouth. And of course, patients sedated and paralyzed usually when we do this. And so what I do is I use the laryngoscope to look down someone's throat so I can see the trachea, their vocal cords, and then I can pass that tube through their vocal cords, inflate the balloon, and that creates a direct seal in their airway so that if any were to vomit, bleeding, anything else, we would be able to control their airway without risk of injuring their lungs with those other materials.
So before we see the demonstration, so all of our students, you all included at one time or another, you have to go through this training, correct? And that's also part of the skills day that we had.
Yes.
Okay.
So what and different types of physicians use intubation at different levels in their training. Emergency medicine, anesthesiology, and those kinds, they tend to do a lot of intubation because in emergencies, obviously you want a quick way to control someone's airway if they're unconscious. And in anesthesiology, you're using the definitive airway management so that surgeons, like Sam wants to pursue, can perform their procedures, can do their surgeries while we take over their breathing control. So that we can keep the patient as sedated as possible so they don't feel pain, so they don't remember the surgery, etc. And the further we are as far as a neuro decline or a neurosuppression, the more they need ventilatory support.
All right, I don't know why I'm getting anxious, but let's see what's going to happen. Did I hit the mic? Sorry. So let's see. Okay, so let's go ahead and demonstrate. Tell us what you're going to do.
Okay, so this is
Does he have a name?
Well, I've called him many names over the years, but we can call him Sid for purposes here.
Can we call him Chris? Chris is our videographer.
Yeah, we can call him Chris.
Okay.
That's fine.
Chris.
Chris has hair, so this is more appropriate. Okay, so this is a stereotypical airway management trainer. And as you can see, it just involves the head, the upper part of the thorax, and then you can actually see the lungs down here. Okay. The tool we were talking about earlier is a laryngoscope, and that's what this is, okay? Now, this is a particular one called a Mac blade, but what happens is you snap it open, and the light turns on, okay? So that allows us to be able to see where we're looking down the patient's throat.
Okay.
All right. Now, this is your endotracheal tube. Many of you have probably seen this on TV.
Yes.
Yeah.
It looks big, though.
It's really big. It's a lot bigger. So this is what's called an 8.0. It's 8 millimeters internal diameter. Okay. It's a bigger tube, but these mannequins are designed big. So
is it special type of plastic?
I mean, it's medical grade rubber, medical grade plastic. So it has a low propensity for static discharge. That's mainly the only difference besides this and some like PVC tubing that you might get at the hardware store.
Okay. Go ahead.
Okay.
I'm very anxious about this. I think my palms are sweaty too.
Okay. So typically what's happened by this point when we've chosen to do an actual intubation of a patient is there has been significant mental decline or we have sedated them to such a point that we need to control their airway. Okay. So these patients are typically paralyzed. They have no gag reflex. And they're heavily sedated, so they don't know what's going on.
Right.
Okay. So the easiest way to do this is, and I would typically be wearing gloves, but for demonstration,
for the purpose of a demonstration. Safety first. He'll be wearing gloves.
Be wearing gloves. What I'm going to end up doing is I'm going to pry the patient's jaw open. Okay. Then I will enter the patient's mouth with the laryngoscope blade, passing the tongue.
And is this a one-person job?
This part?
Okay.
Yes.
Okay.
And a left-handed procedure. So all you righties out there, you're out of luck. I'm sorry.
Oh.
Okay. So what I'm doing is I'm pulling the tongue up out of the way. Okay. And I can see the epiglottis. Now I'm going to walk myself forward just a little bit more. I'm going to enter into what's called the vallecular space. We're lifting the epiglottis up out of the way, and I can look right down this patient's throat, and I can see his vocal cords. Okay. Now what you do is with your right hand, left hand, you hold it open. Right hand, you take the tube and you aim the tube to pass between the patient's vocal cords.
Oh my gosh. And since Chris is sedated, he doesn't feel anything.
And since Chris is sedated, he will not feel this at all. He might be a little hoarse afterwards. So I've passed the tube.
Do you feel pressure going in? Do you really have to push, or is it going in?
Since this is like a hard foam rubber and a hard plastic, it's a little bit more difficult. But on a real human, the tissue is much more pliable. So this is actually quite a bit easier on a real person.
On a real person.
It's a higher stakes game though, so you're a lot more nervous. So that's why it's important to practice on the mannequin. It's difficult, so that when you get to real human tissue, it becomes a lot simpler.
Okay, gotcha. Okay.
So at this point, I've passed the tube through the vocal cords. I'm going to withdraw what's called the stylet, nice little rigid thing that holds things in place so that it doesn't bend over. We would inflate the cuff of the balloon on the far end to seal off the trachea. Taking this, if you don't mind. Thank you. You take the bag valve mask, put it over top, and you notice I've got lung rise and fall.
That is so cool.
All it is.
Wow. Now, something like this, how do you know it's going through properly?
So you have to actually maintain visual contact the whole time you're going through. So what I'm doing when I'm holding the laryngoscope and I'm holding that patient's head up off the table and I'm pulling on their tissues is I'm actually watching the tube pass between the vocal cords.
Okay.
Once I see the tube pass between the vocal cords, I can go a little bit further. There's a little bit of a line on there that you're like, oh, there we go. There's my line. I've passed into, and I'm now safe. I can back the laryngoscope out of the mouth and inflate the balloon and create that.
And the video
circuit
that everybody's seeing right now through the magic of editing is an actual, it's video of the device physically going through, correct?
Yep.
Okay.
So,
and that allows you to see where you're supposed to be going and
Yes.
how it's working. Your background, you're a military medic, correct? That was your background?
I was actually a civilian
Okay,
medic.
okay.
So I was a civilian flight medic.
Okay. And so you had this background as well?
Yes. So part of the reason why I led this portion is because I had been doing this for about 15 years before I came to medical school. I've done hundreds of intubations in the field in uncontrolled environments. So sitting here with you is actually a nice kind of relaxing change to what I used to do.
I'm sure.
But practice makes perfect. So
Yes.
I've done hundreds of these simulated intubations alongside real tissue intubations that I've done before too.
All right, well, as you can see, we changed positions because now we're going to talk about how to properly put on a gown and gloves and keep everything sterile.
Yes. So Andrew will be demonstrating how to properly sterilely glove and gown. So first, we've already opened the materials, which would be on our sterile field, which is not existent right now.
They come in these packages,
They come in those packages that would not be on the field. You open them with that package onto the field so that it's still sterile. So now that he has washed his hands for surgery, he's going to grab the center of this gown, yes, the left side there, because that part, this center, yeah, perfect. Because that part will be facing his body and will no longer be sterile after he puts it on.
Okay.
There are 2 flaps on either side. You're going to insert your hands in those flaps, and then you will step away from your table, ideally. I know we don't have a ton of room.
Here, I can slide this over. Go ahead.
And then you will unfold the gown, allow it to unfold in front of you, and step into the arms.
And this is a 2-person process.
It is, because now I'm going to come behind Andrew. Will you turn this way? This way. I'm going to secure the top, and then there's a tie in the back that I'm going to secure for him.
So would you have gloves on yourself?
No, I am not sterile, so I don't have to be part of the sterile field to do this.
Okay, okay.
So now that he's got the gown on, we are going to have him put his gloves on. So we will bring this back. Without taking his hands out of the sleeves, he's got them partially out of the sleeves a little bit. He's going to use his sterile cuffs to open the package of gloves.
This part he has to do on his own.
Yes, I can't help because I don't have any sterile gloves on. So now he's got a left and a right glove. There are sides to these sterile gloves, unlike the common ones you find in a box.
I did not realize that. Okay.
Yeah. So depending on which hand you want to glove first, you will grab the inside cuff of that left glove he's going to do first. You have the thumbs facing each other as you place it in, and then he will slip this over his left hand. It is tricky to do.
Practice makes perfect, right?
Yes.
And that's why y'all have to practice this and have these skills days to really nail this.
Exactly. A lot of times you get to the operating room and if you don't have this skill practice before, it takes a while, it looks funny, it takes time. Then he's going to continue putting this glove on and pull the cuff down over his sleeve a bit to cover the cuff of the gown.
Oh, so he's got to cover that. Okay.
Now that he's got one glove on, he's able to use this hand more freely to help put the other glove on.
Oh my gosh, so this truly is, you got to give yourself time.
You do. It does come with practice, like you were saying. The more you do it, the faster you are. I've known scrub techs for a lot of years that do it in under 20 seconds.
Well, he was able to get that one on much faster, right?
Yes, it's much easier on the other hand.
And so now he can adjust the other glove as well. He's adjusting the left, he's got the right one.
So he is fully sterilely gowned and gloved. Now he's going to grab the top part of his card on front of his gown with his right hand, top part. Grab the tail end of this one. Hand me the red part of this card, and now you're going to spin. Now you're going to continue to spin and reach and grab this part, and now you can tie, and I have the card.
So that's the two-person process. That other person has to get that card and do the initial first wrap, so to speak,
Yes.
and then he can finish everything up himself.
Exactly. And once he has his gown tied in the front, he is sterile and ready to do whatever procedure he needs to do.
What about the mask?
Ideally in the OR, you would already have your mask and eye protection on before you start the sterile gowning and gloving.
Oh, understood, understood.
When you are sterile, you're not going to move your hands above your nipple line and not below your belly button. So that is a
Why
sterile
is that?
zone.
To accidentally
Yes, it's not. It's
hit
considered
something or touch
unsterile.
something? Okay, so you technically really got to walk around like this?
Yes.
How do you feel?
Constricted.
He's not mic'd, he feels constricted. So do you have any suggestions, recommendations for really trying to perfect this?
If you can get your hands on a gown and gloves, you can save them and reuse them if you can fold them. It's kind of hard to do if you don't have access to that. But I highly recommend going to things like we had the Surgery Skills Day, because that is an opportunity to practice with low pressure. If you mess up, it's okay. If you're not sterile, it's okay. Whereas when you go into rotation, that's a little bit different. You're expected to be sterile.
Absolutely. Thank you both so much. I know that the information is going to be so valuable for our students and the community, so thank you.
Thanks for having us.
Of course, absolutely. That's our show. If you have questions about our program or a story idea, please send us an email. Our email is communications@burrell.edu. Also, you can follow us on any of our social media platforms. Our handle is Burrell College. I'm Sidney Alvarez. Thanks for joining us, and until next time.